This is my volunteer, Angel Price, and he is going to answer the questions for the assessment. Okay. Client name is Angel Price. And the agency is Mokoshu Behavioral Health.
Yes.
Okay. And date of birth?
8/30/86.
3086. Okay. And today's date is the 12th. Okay. What is your present problem?
Alcohol.
Okay. You're here for a DUI?
Yes.
Okay. The first one. And your client involvement with other agencies. Have you gone to any other agencies besides this?
Yeah, in Anchorage.
Okay, in Alaska. Okay. What are your life circumstances in your family? With your family, your father passed away?
Yeah.
Okay, and your mother is a drug addict?
Yeah.
Okay. And your siblings also use?
2.
Two, and they both are active
Addicts.
addiction?
Yeah.
Okay. And your social, your friends are also in addiction?
Yes. Drug and alcohol.
Drug and alcohol, okay. And do you have any support that would help you to stay clean and sober once you're released?
A few. Yeah.
Okay. Friends. And we'll go on. Your legal issue is the DUI that you have now, correct?
Yes.
Okay. And did you have another problem with drugs or alcohol before this? Didn't you have a possession charge?
Not that they know about, no.
Oh, okay.
But I do have a problem.
Okay. And your education, you went to 9th grade?
Yeah.
Okay. And your occupation right now? You're unemployed?
Yes.
Okay. And your finances, you don't have any income at the moment?
No.
Okay. And you received DSHS?
Yes.
Okay. And do you have any psychological or environmental problems? Your friends also use?
Yes.
Okay. So the area that you stay in, it's not a safe area?
No.
Okay. And do you have any current medical conditions?
Diabetes?
Okay. And your physician is Mokoshu, right?
Yes.
Okay. And are you pregnant?
No.
Okay. And your primary care physician is also Mokoshu?
Yes.
Okay. And the current medications, just your diabetes medication?
Yeah.
Okay. Do you have any side effects?
No.
Okay. Any allergies to medication?
None that I'm aware of.
Okay. Do you feel safe at home?
Sometimes, yes.
Okay. Do you feel threatened in any way?
Yeah.
Sometimes, yes.
Yeah.
Okay. If yes, describe. You were saying that the people in your home also use and sell and have weapons?
Yes.
Okay. And have you been abused in any way recently?
Physically.
Okay. Physically, who did the abuse?
Girlfriend.
Okay. And was any legal action taken?
No.
Okay. Do you have a safety plan?
No.
Not set up yet? Okay. Do you need shelter?
Yes.
Okay. Do you need protection from your abuser?
Yes.
Okay. Your self-rating for suicide or homicide on a scale of 1 to 4, 1 being none and 4 being extreme. Your rating for suicide?
2.
2. Okay. And self-rating for becoming violent?
3.
3. Self-rating, your rate do you consider for homicide?
2.
2. Okay. Have you tried to commit suicide previously?
Yes.
Okay. And what do you consider to be your suicide risk? None, or you have a plan, or extreme, significant, moderate?
Moderate.
Okay. And your evaluation of violence? Also moderate?
Yeah.
Okay. Due to the people in your home?
Yeah.
Okay. Have you had a mental status exam?
No.
Okay. Your appearance is age appropriate. Okay. Time situation. Okay. Also we have do you think you use more under stress?
Yeah.
Okay. Do you continue to use when others have stopped?
Yeah.
Okay. Have you lied about consumption?
Yeah.
Okay. Have you tried to avoid others while using?
Just to hide it. Yeah.
Okay. Have you been drunk or high for several days at a time?
Yeah.
Okay. Do you neglect your obligations while using?
Yeah.
Okay. Usually you use more than intended to use?
Yeah.
Okay. Do your needs increase when you become intoxicated?
Yeah.
Okay. Have you tried to hide consumption?
Yeah.
And do you use before noon?
Yeah.
Okay. And you cannot limit your use once you've begun?
Yeah.
Okay. And have you failed to keep promises
Yeah.
to reduce your use?
Yeah.
Yes. Okay. Can you describe attempts to stop? You said you went to IOP previously?
Yeah.
Okay. And how would you describe a circumstance that usually led to relapse?
Bad news from girlfriend or family.
Okay, family situation. Okay. And are you involved in AA or NA?
AA.
Okay. What are your goals or expectations after you complete treatment?
I'm just trying to stop. That's the only goal right now.
Abstinence right now. Yeah. Okay. I will get this summarized for you. Okay. We can get you some help with a place for you to go to. Are you willing to go to, after your release, to the Malcolm Street Recovery House?
Yeah.
Okay, we can get that set up for you so you'll have housing when you leave. And you can move on